Septic arthritis. Septic arthritis is an infection of any kind finding its way into the joint space. Because synovial lining has no basement membrane, it is relatively loose, and both bacteria and antibiotics easily find their way across it. Septic arthritis is relatively rare in an undamaged joint. The risk of infection is directly proportional to the degree of joint damage. Osteoarthritis (DJD) provides a slight risk, with rheumatoid arthritis having a greater risk because of greater destruction. The greatest risk is with a prosthetic joint. Bacteremia can spread into the joint space, which is why endocarditis and injection drug use cause septic arthritis. Presentation. The joint is warm, red, and immobile, and often has a palpable effusion. Chills and fever happen because of bacteremia. Diagnostic tests. The best initial and most accurate test is aspiration of the joint with a needle, arthrocentesis. X-ray, CT, and MRI are not useful. Joint fluid shows leukocytosis, more than 50,000 to 100,000 cells, predominantly neutrophils. Blood cultures, 50% sensitive. Gram stain, positive, 50%. Gram-positive bacilli, 75%, with Staphylococcus synovial fluid culture, 70% to 90% sensitive. Treatment. Ceftriaxone and vancomycin are the best initial empiric therapy. Adjust antibiotics according to culture results. Prosthetic joint infection. Prosthetic joints are placed in over 100,000 people per year in the United States. An infected prosthetic joint gives a warm, red, immobile, and tender joint, but without an X-ray or CT scan, it is not possible to tell whether the infection is limited to the joint space or has spread into the bone around the implantation of the joint. MRI is difficult to perform with prosthetic joints because they are made of metal. If the Staphylococcus is sensitive, vancomycin is associated with a worse outcome than a beta-lactam antibiotic such as oxacillin or cevazolin. Switch drugs if the organism is sensitive. If there is lucency around the implantation of the joint on radiologic imaging, or if the joint is physically loose, infection is likely present at the implantation site. Treatment of infected prosthetic joint. It is much harder to clear or sterilize septic arthritis associated with a prosthetic joint without removing the joint. Hence, the first stage is to remove the joint, treat with antibiotics for 6 to 8 weeks, and then replace the joint. The most common organism for recently placed artificial joints is Staphylococcus epidermidis.